Hi, this is Dr. Ray Lueck, and I want to share with you today another approach that I use in my office. It's called Heart Rate Variability Biofeedback. The software comes from the Heart Math Institute, where they've done extensive research on the efficiency of the electrical signal from the heart. The heart is the strongest electrical generator in the human body. And what they found is that when a person is angry, anxious, depressed, worried, that their heart sends out an erratic electrical signal. There's a verse in the Bible that says, "A cheerful heart is good medicine, but a crushed spirit dries the bones." So what ancient wisdom knew 3,000 years ago, that happy, cheerful people tend to be healthier people, and bitter, angry, frustrated individuals tend to have more health problems, modern science has proved. The Heart Math Institute has done extensive studies on the electrical signal from the heart, and they found that when people learn how to create a state of positive emotional and mental well-being, the electrical signal from the heart is much more efficient and helps their body physically and helps their emotions and mental state. This is comparable to if you had a light in your room and the cord to that light were frayed or crimped or damaged in some way, and the electrical signal could not pass through efficiently. The bulb would flicker on and off and it would burn out much easier. But if the bulb were getting a smooth flow of electrical current, it would last much longer. The same is true for our body. When we get a smooth electrical flow from our heart, our organs, our brain, everything works much more efficiently. And so I'm going to walk you through a little program that I use to show you how this helps change the efficiency of our heart. This is what I call my $64,000 treatment session, though I don't charge that much for it. But the reason I call it that is because the Heart Math Institute has shown scientifically that practicing this approach on a regular basis will lower your blood pressure, lower your cholesterol, boost your immune system, help remove anxiety and depression. The number one cause of death in America today is from heart disease. If you practice this technique on a regular basis, they say that you will never die of heart disease. So this is an extremely powerful and effective tool for us to use to improve our sense of health and well-being. Okay, so I'm going to begin a session now with an adult male, and let's see. What I do is I start with a baseline, so we're just going to check this individual's heart rhythm, heart rate, and kind of to see how balanced his heart is. So we're going to do a 3-minute baseline measure of the heart rate. Okay, I want to show you the baseline recording of this individual, again, an adult male. We can see that the average heart rate is 60 beats per minute. For the healthy adult, we're looking at 60 to 80 beats a minute, so this is a good range. But what we see here is what's called the coherence rate. This individual is 95% in the low, 5% medium, and none in the high, which is pretty typical when I work with people. Typically they're about 80 to 90% in the red, and very little in the blue. The green is the high, and almost no one gets there initially. So we can see the heart, the electrical signal from the heart. We can see a bunch of up and down lines, but it's kind of jagged and erratic. The bigger the peaks and valleys show, the healthier the heart is. So again, this is an adult male who has a very healthy heart, but it's not sending out a good electrical signal. During the baseline, I ask the person just to sit still for 1 minute, and they think about a problem for 1 minute, and then I ask them to relax for a couple of minutes. So here we can see that during the first minute, when he was thinking, his heart rate was down here. When he thought about the problem, it elevated a little bit, not a lot. And when he relaxed, it kind of stayed the same, and then came down a little bit at the end here. Typically when I do this with people, depending on how well they can think about the problem, usually their heart rate is at a certain rate and it goes up when they think about the problem, and then when they relax, hopefully it's going to come down, but some people, they have difficulty coming down. When this line here goes up, that means they're creating more of the positive rhythms. So again, during the first part and then to thinking about the problem, I usually see this come down, and then as they relax it starts to go up, but again some people have difficulty getting it to go up higher, and that's what we're going to work on now, is showing this individual how to get his heart from the low coherence into the high coherence. Okay, we just went over the breathing stress management exercise with Johnny here. If you look at the lines now, you can see, they're smoother, bigger. These kind of compare with his breathing, so I've taught him how to breathe differently and how to change his thought patterns. So we're going to look at kind of that electrical signal and see how it's different. Now we did a 15-minute exercise, so this compresses kind of the breathing into a 15-minute pattern, so it's a little tighter than before, but see how big the peaks and valleys are? This is exercising his heart. The bigger these peaks and valleys, the better we have what's called the heart rate variability. So that's what we're working on, is heart rate variability. And the more you practice this, again, you will never die of heart disease or have that kind of complication if you make this a regular practice of your life. Here we can see that this line, where initially it was on the bottom, is going up very, very well, very smoothly. Now, it took him a little bit of time to get into the positive breathing, so at the beginning he was working a little bit too hard. He was only doing about 2 or 3 breaths a minute. We want to do about 6 or 7 breaths a minute, so once he got into a more comfortable rhythm, he started going up very well. I had him thinking about different problems, and he may have gotten tired or lost his breathing a little bit, so he came down a little bit here and then a little bit at the end there. But if you basically when you do the breathing properly, you're going to be in the blue. When you do the breathing and the positive thinking properly, you'll be in the green. So we can see that he went from being 90% in the red to being 46% in the green and 32% in the blue. So we have a significant difference there. Now there's one other exercise that I teach people, so I'm going to teach that to him now, and then we'll look at the results of that. Okay, here's the recording of John after doing just the 1-minute breathing. So within one session, I taught him this exercise. We did a longer version of the breathing and then a shorter version, which I teach people. So there's 2 exercises I want people to practice. So we can see here, look at the difference now between the electrical signal from his heart from initially to now, how wonderful and big those peaks and valleys are. We can see the line here, he's going up like a rocket ship, just perfect, and look at this. So he went from 90% in the red, the low, the poor, to 100% in the green. So we see a significant shift, but that's what's exciting about this approach, is that we can see how significantly these changes occur in people. Okay, we're going to look at the first session, and just so you know, it's the real thing. This is the date and time of the first session. And so here we see the electrical signal. We see where he's at with the coherence and this peak. And then what this is a picture of the autonomic nervous system. So this shows the parasympathetic and the sympathetic branches of the autonomic nervous system. So when someone is stressed out, the parasympathetic branch has a spike here, and over time, if they're experiencing too much stress for a long period of time, the sympathetic nervous system shows kind of the extent of adrenal fatigue. What we want is to see a spike right here at the 0.10. Okay, so this is the before, and now we'll look at the after. So we'll choose the last session that we just did. And here again we see those nice smooth peaks and valleys. We want about 6 breaths a minute. And now we'll look at the sympathetic and parasympathetic branches. Okay, so now we see this spike right here at the 0.10, which is what we're looking for. We see that there's very little on the parasympathetic, and this has gone way down on the sympathetic. So as John continues to practice this, he's going to create significant health changes in his heart and in his mind. So this is going to be a wonderful tool for him to use, and the reason I like using this is because I can show people pretty much in one visit how to make significant changes in their life that they can use throughout the rest of your life. So I hope this has been helpful for you. If you have any questions, I do have some audios available that you can learn to do these exercises for yourself, so please contact me. And if you have any other questions, just let me know and I'll do my best to answer them. Thanks so much, and I'm wishing you the best in health and wellness and enjoyment in your life.